We have team coverage tonight with Grant Herms looking into Michigan's vital role in getting this vaccine to the entire country.
But we begin with Rob Maloney and the state releasing the order in which people will be vaccinated and how they'll get it. Good evening, Rod.
Good evening, Karen. It was an hour plus long press briefing that they just finished up just a few minutes ago. It's a very complicated rollout, lots of ins and outs in this thing, but Dr. Janae Caldoun, the chief medical officer in Michigan, said the words that a weary state has been longing to hear.
I'm very excited about the vaccine distribution. It means that the end of the pandemic is near, and we are working diligently with partners across the state to distribute the COVID vaccines.
Yet, for all the optimism, for most of us across the state, it's going to be a while before the vaccine is available. Its distribution is starting in small lots and in two different tiers. First tier from Pfizer, 84,825 doses get sent here next week to Michigan, somewhere between the 15th and the 17th. This vaccine needs ultra-cold freezers stored at 70 below zero centigrade to be exact. That limits the storage capacity and the number of doses. Moderna's vaccine isn't expected for a couple more weeks. Michigan can expect 173,600 doses initially because there's no need for freezers and it comes in smaller physical doses. Now, the state's goal is to have 70% of the adults vaccinated by the end of 2021, roughly 5.4 million people. Here's how they're going to roll it out in phases. It all starts with phase 1A, persons in healthcare settings, direct and indirect, like long-term care facilities. Then there's phase 1B, where workers in essential critical industries like K-12 educators and child care workers. Next in line, 1C. Those are the high-risk persons, age 65 plus, and others with underlying conditions like high blood pressure, diabetes, and COPD. And then finally, phase 2 will be a massive vaccination campaign for the general public.
It is our hope that we will be able to start offering the vaccine to the general public by late spring of 2021.
Now, that was the simple explanation of all of this. There are many intricacies. The ins and outs in this are myriad. It took them a long time to explain it. If you want to spend some time reading about this and looking through the state's plans, go to clickondetroit.com. We have the state's website for the distribution there, and you can go and spend as much time as you need to figure out where you fit in. Back to you.
Rod, I want to go back to you talking about the phases. So will one phase have to finish getting its vaccine before the next phase can receive theirs?
Well, the simple answer is no, but there are many contingencies in here, and they're saying, you know, as everything with COVID, it can change in a dime. But what they're saying is there are going to be overlaps, that some people will be able to jump in say, phase 1B ahead of some of the people in 1A and moving on down the line. But again, we just have to roll with this thing.
Sure, we will. Okay. Rod, thank you.